everyone. Good morning and welcome to today's community webinar, which is all about how we look after our child's mental health. I can see we've got lots of people joining, so welcome, get comfortable. I will be starting in just a moment. I'll just do some very quick housekeeping. So just so you know, first of all, I'm Dr. Katherine Frogley. I'm a clinical psychologist at the LightHouse Arabia. And today we're going to be walking through a webinar that's all about child mental health. So hopefully you're all in the right place. So the webinar is recorded. So that means that you will have a copy of this recording later on today, perhaps also with a leaflet too. And I will be talking and going through some slides for about 40 minutes, maybe 45 minutes, but I will leave time at the end for any questions that you might have. So please feel free to jot them in the chat or the Q&A, and I'll come back to them at the end of the webinar. They are anonymous if they're in the Q&A, so only I can see them. So please feel free to ask any questions and I'll make sure I get to them at the end of the webinar. Unfortunately, whilst I'm talking, I can't see the questions as they come in. So just bear with me until I get to the end and I'll come back to them. All right, without any further ado, let me just make sure that my slides are working. Okay, so let's get into today's talk. So we're talking about your child's mind matters and how you can support the mental health of your children. My name is Dr. Katherine Frogley. I'm a clinical psychologist trained in the UK. I'm also the education lead at the LightHouse Arabia. That means that I work predominantly with children and adolescents, but I do also work with adults, parents, all ages really, but I do have a particular passion for working with children and adolescents, and that's where a lot of my work has been focused. So I'll be bringing in as much of that experience and knowledge into today's session. Just in case you're not aware of who the LightHouse Arabia are, we are a mental health and wellness centre in central Dubai. There's lots of wonderful things that we do at the clinic. So if you are concerned at any point about a child, or if you're just interested in wellness, because it's not only when there's a problem that we can be a support, there are lots of things, lots of activities that we're doing, some of them free, many support groups. So please feel free to check out our website. I'll share that at the end if you've got any desire to kind of look at what other things we might do. And here are some of the lovely people that I work with. We're a lovely big team. But today, just thinking about our agenda, so we're going to talk about why child's mental health matters, why this is a topic that we're talking about today, and why at this particular moment in time is this such a pertinent topic. So I'm going to be talking a little bit about the pandemic that we're in, and obviously there's been a spike in cases recently, which I'm sure is troubling some of our young people, but it has been now ongoing for 2 years, and that's a long time for our young people to be going through this, as it is for us, but also the other context in which they live, which might make life somewhat more challenging. We're going to talk about what we mean by mental health. We're going to talk a little bit about depression, anxiety, things that you might need to look out for when it comes to your children, safeguarding children's mental health. So some of the things you can do to ensure that they have good mental health. And then, of course, if there are signs and symptoms or concerns that you're having, I will guide you to some support that you can do to keep them safe and well. So let's start by thinking about why this matters now. Now, of course, we are currently still in the midst of a global pandemic that has, it's unprecedented what we've been through in the last 2 years. And I know particularly here in Dubai, there has been a spike in cases. And I know back home for me in the UK, there's also a lot of concern and anxiety around, again, about the rising cases in COVID. And I think this, has an impact on all of us, but, I can't really imagine what it's like for the young children and the adolescents that are going through this now. It's a collective crisis, essentially, that we're going through, and there's a grief response. There's lots of things that we're missing, lots of losses that we're going through that keep changing. There's an inconsistency around it as well, which is so hard for young people to be going through. And I know that the research, there's been a little bit of research here in the UAE. We actually kind of surveyed some of the young people that we see, and we've seen a rise in anxiety and low mood in our young people, and particularly with things like obsessive compulsive disorder and certain types of anxiety, we've seen a little kind of shift up in the last, year, 2 years since the COVID pandemic started. And also that is similar to research that's coming out in the UK, where people are saying that they're really struggling with their mental health. And I think the population that are struggling the most actually are our adolescents, because they've just missed out on so much freedom, so much independence, so many of those moments at school where it really helps you to define who you are. So things like, being in the school concert or playing football for your team or having your final prom. And I know that some of these things are coming back, so that's good. But a lot of our young people missed out on those really important moments that really help you to feel that you know who you are. So that is something that we're all going through collectively that is very, very tough. But this pandemic is also occurring on top of an existing epidemic of poor mental health. And there is lots and lots of research that's coming out and had been coming out even before the pandemic around the state of the mental health of our young people. A lot, but not all of that is due to the context in which they live. So we, my generation, we grew up with, I didn't get social media and a phone and things like this until I was in my kind of late teens, whereas our young people are growing up with iPads and screens and social media and TikTok and all these things from a much younger age. And the internet is just so widely available to our young people. And of course, that comes with many positives, that comes with a lot of advantages. There's a wealth of information at our fingertips, but it also comes with some difficulties as well. And I'm going to talk a bit more about this in a moment. But I think, we are parenting children in a very different time. I didn't grow up in the world as it is today. You probably didn't grow up in the world as it is today. So our children are having to navigate something quite different to what we were navigating. And there's so much more of an influence. So rather than comparing yourself to the people in your class at school, or if you were being bullied, it was only happening when you were at school. Now, because of the online engagement, people are comparing themselves to millions of people across the world. If you think about TikTok, for example, there's just thousands and millions of people that they can see and compare themselves to. And if they're being bullied or if they're experiencing some difficulties, that doesn't stop when you leave the school. That sometimes continues through Snapchat and TikTok and all these other kind of ways in which children can harm other children, essentially. So it's a different world, is what I'm saying. And that has some consequences on the mental health of our children that we need to be aware about, and we need to help them navigate and learn about too. As a result of some of that, we're seeing that our children are more isolated. They're spending less time in real life situations with people. Not every child, but for some children, we're seeing a lot more online engagement and a lot less real life engagement. And again, that has real life consequences in terms of their social skills, their confidence, their anxiety, etc. So again, just something for us to think about, and we will go into this more. Another reason why I think this is such an important topic, and why actually I've chosen to work predominantly with children and adolescents, is because mental health problems are prevalent in this group. And I know a lot of people, previously, maybe even still now, tend to believe that children are very resilient, that they're not impacted by things. And they are in some ways, their brain is still very much malleable and flexible, and they can learn a lot better, but they are the subject of their experiences. So they are vulnerable to mental health, and we need to be aware of that and support children through their emotions and their vocabulary to help them reduce the risk of a mental health problem. We know that 1 in 5 children between the ages of 13 to 18 have or will have a serious mental illness. So 20% of youth live with a mental health condition. And we know that these statistics are based on people who go to a doctor and get a diagnosis. There may be many, many more who never go to the doctor, and therefore it's likely that these numbers are actually higher. 11% have a mood disorder, so it's impacting their mood. Typically that would be depression. 10% have a behavior or a conduct disorder, so that's where their behavior is disrupted. They're more of the challenging group of children who are not following the rules, who are breaking rules and kind of disobeying boundaries. And 8% of our youth have an anxiety disorder. And this is something we're really seeing increase, as I said, as a result of the pandemic. We also know that with the adults I work with, 50% of people will have already had those first signs and symptoms of a mental health problem before the age of 14. So we know that the adults that I see, the people that I work with in later life, probably started, or 50% of them started showing some of these signs and symptoms much, much younger. And so, again, a passion of mine is to intervene early to prevent young people from going on to develop more serious, significant mental health difficulties in adulthood. We know that it takes on average 10 years for somebody to start experiencing symptoms and then going in to get treatment. So if you think about, you wouldn't leave heart disease for 10 years, you wouldn't leave cancer for 10 years. But when it comes to our mental health, we tend to have a huge delay between the time that we start thinking about signs and symptoms and when we actually go in to seek support. So 37% of students with a mental health condition age 14 and older drop out of school. There's a huge cost to learning. Even if those children stay in school, if they're really struggling with anxiety or depression, it's going to really impact the quality of their work, their ability to focus, to pay attention, to get the grades that they deserve. And we know that 70% of youth in state and local juvenile justice systems have a mental illness. So a lot of our young people who are committing crimes are actually quite unwell. And very sadly, suicide is the third leading cause of death of youth between the ages of 10 to 24. So obviously this is in more serious cases, but where mental health problems are serious and left untreated, unfortunately, we know that young people sadly sometimes do commit suicide. So we really need to pay attention to our young people's mental health and support them as much as we can. So as I said, there's a prevalence, it does exist. We do see young people who do experience mental illness. As I've already mentioned, 20% of children and adolescents, half of those begin by the age of 14 and 3/4 by the mid-20s. And the suicide is the third leading cause of adolescent death worldwide. So it's important, is what I'm trying to say. So let's just first of all be very clear about what we mean by mental health, because I sometimes think that mental health is a bit of a dirty word, and sometimes we associate mental health with mental illness, and we assume that we don't need to think about our mental health unless we have a mental illness, when in actual fact, we all have mental health, just like we all have physical health. And there will be times in our life where our mental health is really good, we're sleeping well, we're taking care of our mind, we're meditating or we're journaling, whatever it is that helps us to feel good in our mental health. And things feel really good. And there will always be times where our mental health is poor or, not so good. I think particularly during the pandemic, for myself, for my friends, for my family, for my colleagues, for, all the people I work with, we all experience moments of poor mental health where we were anxious, we were worried, we were concerned, we were fed up. So we've all had moments where maybe we're not taking care of our mental health, or things don't feel so good, and that is the natural part of being human is we will have good and bad moments. Just like with physical health, sometimes we will be exercising, be kind of drinking all the fluid that we need, taking our vitamins, and we'll feel good. And there'll be moments where we're not doing those things and our physical health doesn't feel good. And it goes up and down on this spectrum, depending on what's happening in our life and how well we're kind of implementing things that we know protect our physical or mental well-being. So I want us to all be clear that mental health is something that every single human being on earth has and needs to take care of. We all have our own strategies, our own ways of staying well and healthy, every single one of us, whether we're conscious of that or not. Some of these things are perhaps intuitive. It's important to our overall health. There is a phrase in the UK within the NHS that there is no health without mental health. And we know more and more research is telling us that when our physical health is poor, it impacts our mental health, and vice versa. If our mental health is poor, it's going to impact our physical health. These two parts of us are so interlinked, constantly communicating with one another. We cannot have one without the other. If we're somebody who takes pride in our physical health, we also need to take pride and look after our mental health. When we're talking about mental health, what we're talking about is the health of our mind, our thoughts, our feelings, and our behaviors. As I said, it's on a continuum, it's flexible, it's changing, it's not static. It doesn't, you're not somebody who either has good or poor mental health. You have both. You move up and down that spectrum, depending on what's happening in your life, what's going on at that particular time or day. Our mental health is not something that is only for crazy people or for weak people. We all have it. It's not the same as having a mental illness, and I'll define this in a moment. And it's not about feeling good all of the time. And I think particularly with our children, we sometimes fall into a trap of wanting them to be happy all the time. And I certainly remember as a child learning that I had to be happy, or I should be positive and happy most of the time. And in my family, it wasn't always necessarily dealt with very well. When I was sad, or particularly when I was angry, that didn't seem to be such a welcome emotion. But the truth is, as humans, we're not happy all the time, and we shouldn't be. We have emotions for good reason. It alerts us to things that we need to deal with. If we're angry, it's often because there's an injustice that's happening. Or if we're sad, it's telling us that we need to repair something, or we don't want to do something again because it upset us. Or if we're jealous, it's often about connection. So all of our emotions are part of being human, and we need them all. And we want to help children to learn how to manage all of those feelings and not simply assume or place undue expectations on them to be happy and positive all of the time. We sometimes refer to this as toxic positivity, and unfortunately there is a lot of that available. Mental health is not a fixed state. As I've already said, it changes, it's continuing, it's on a continuum. Just like this. So there's a good and a poor mental health spectrum. We move up and down that spectrum all of the time. So what is the difference then between having some days of a poor mental health versus having a mental illness? So sometimes having a lot of poor mental health can result in mental illness, but sometimes something will happen or something difficult will be experienced by that person, and they'll move from good mental health straight into mental illness. So it can happen either way. But what we mean by mental illness is when there are major changes to thoughts, feelings, and behaviors. It's when those symptoms are present over time. In most categories, we're talking about 2 weeks consistently, sometimes more, depending on what diagnosis we're talking about. And it has a significant impact on that person's functioning, and it interrupts their life. So if we're talking about children what we might see is that it's impacting their ability to do their everyday things. Maybe they're not getting out of bed. Maybe they're not able to go to school. Maybe they're not spending time with their friends. Maybe they're not eating well. There are certain things that normally they would be doing that they're significantly not able to do as a result of the emotional feelings that they're having, the thoughts that they're having, and the behavior. Often when we think about mental illness in society, we often think it will be obvious, that we will know when somebody feels depressed or anxious, and we will see it. And sometimes sometimes we do see it in people. But what I've learned over the years as being a psychologist is often it's not obvious. And often it's the people who appear very successful or very happy or very kind of outgoing. It's the kind of the big personalities of your friendship group. They're the people who struggle sometimes. So, we have this collection of people here who all outwardly on the surface probably look like pretty successful, happy, positive people who've made some quite, some of those people have made incredible changes for other people, and yet they have struggled with their mental health and openly talked about it. But had they not, we perhaps would never ever know that these people struggled with their mental health. So we know, for example, Martin Luther King struggled with depression. He attempted suicide in his teenage years. We know Princess Diana struggled with bulimia. Actually, there's lots of shows kind of depicting her story currently. We've got Dwayne Johnson, we've got Elon Musk. There's lots of people who now are talking about mental health struggles. And again, perhaps we wouldn't really see it. And I think the problem sometimes with children, or the difficulty with children, is they are masters at wearing masks. And it is often quite hard for us to see when a child is struggling. Or what I see is that we see a child is behaving differently, but we're not seeing the vulnerability underneath that behavior. And therefore, we're interpreting the behavior as a child who is manipulative or who is just aggressive, or whatever they might be going through. Particularly, I think, in the teenage years, where there's a lot of pushback, there's a lot of boundary pressing. But even in our kind of school-age children, sometimes the behavior, it's very difficult to have that behavior in your house, but we're not seeing beneath the surface what might be going on for that child, why that behavior is happening. They are masters at wearing masks. Often children don't want their parents to be aware of what's happening for them because they don't want to let them down. And that's often why sometimes it can be very helpful to have somebody outside of the family, like a therapist, or it could be a counselor or a teacher or somebody who isn't the parent, to be able to help that child express what's going on to them, because there's less of that fear that I'm going to let you down or I'm going to disappoint you in some way. And we know that mental health illnesses are often invisible to the eye and hard to spot. So I've already mentioned that, our mental health has a huge impact on our physical health, but just thinking a little bit, particularly with young people, we know that young people, particularly the younger children, tend to express symptoms physically sometimes. So you might have a child who is, having tummy aches, for example, or having issues with their skin or digestive problems. There are other clues that we might want to look out for that present quite physically, rather than a child saying, I'm feeling anxious or I'm feeling worried. That can often be quite hard for them. But we know that the mind and body are connected and constantly communicating. So we know anxiety can often present in the skin. We know that severe stress can affect the growth hormone and can severely impact a child's growth. On that note, I've worked a lot with feeding and eating disorders, where the child is not adequately eating enough for whatever reason. Again, that can be due to anxiety. It often is due to anxiety, but there may be other reasons, and that can impact mood and growth and development. Depression can lead to arthritis and diseases of the digestive system. And we also know that depression worsens pain symptoms associated with physical illness. So if a child has a chronic health illness, and they're depressed, it will worsen the pain that they already experience. And this goes for adults as well, in fact. So putting all of that together, I know it's quite a scary bunch of statistics and things to think about, but I want to offer a little bit of hope here to say that the earlier we intervene, the earlier we support a child with their mental health, the much better the outcome is likely to be. So the treatment is likely to be less intense and shorter. There's going to be less of a negative impact on their health. They're going to have a fuller and longer lasting recovery. They're going to not, my concern sometimes with children who perhaps don't get the support is how it impacts their sense of self, because that is a key part of what is developing as a young person. So if you've got mental health on top of you developing who you are, sometimes that can lead to a perception of I'm somebody who cannot manage my emotions, or I'm somebody who struggles with my emotions, or I'm weak, or whatever it might be. So that can sometimes get mixed in with their sense of self and their self-esteem. But if we can help them organize that, support them with that, then it's much less likely to have a big impact on them. I've already mentioned educational achievement can be really disrupted. And of course, in severe cases, self-harm or suicide, which is clearly very dangerous. So just thinking about some of the risk factors. So a big question we always ask in psychology, and a lot of times parents that I work with ask me a similar question, how much is nature versus nurture? And the truth is there's both, there's both a biological and a psychological and social impact. So as a psychologist, we're always thinking about this biopsychosocial model. So that's these three kind of areas. And obviously, the more risk factors you have, the more likely you are to develop a mental illness. But you can have any number of these things and not have a mental illness. So it's often a combination of multiple things coming together that trigger a person. And we know that there is a biological, physical risk factor. We know there is some link to family history. It's not as big as we first thought. So it's not the case that if you struggle with anxiety, your child will definitely struggle with anxiety. Often that's not the case, but it may mean that they have a genetic vulnerability. So if they have that genetic vulnerability and other triggering events happen in their life, it could lead to anxiety or something else. A child who has physical illness, hormonal imbalances, thyroid issues, if their vitamin D is low, chronic illness, disability, all of these things can also impact biologically and make a child more vulnerable to a mental health difficulty, but not necessarily. So it has to be a combination typically. Psychologically, what we see is a child with low self-esteem, who is very self-critical, has a very cynical outlook on life. The thinking patterns of that child can put them at risk. So children struggling with perfectionism or a very kind of highly critical outlook on themselves are more likely to experience mental health troubles. If they have experienced things like trauma, abuse, grief, bullying, if they are somebody who really kind of compares themselves to others, or you're in a family where there's a lot of comparison, all of these things can put your child at risk sometimes. And socially, we've already mentioned a little bit about social media and kind of the online internet presence in their life and how that can impact them. But other things like bullying, peer pressure, loneliness, events like divorce or conflict in the home. Being an expat sometimes has a risk because we're often away from the social support of our families, experiencing racism or discrimination, poverty, war, financial problems. These are all kind of social risk factors that can contribute to poor mental health in our young people. So I've alluded to social media. I've talked a little bit about this. Obviously, we cannot get away from it. It's everywhere. It's such a part of what we do in life at the moment, unfortunately. But I think it's really important that we, as parents, are very aware of the impact that this is having on our young children and our adolescents. So one of the most common things I'm seeing, and it worries me a lot, is sleep. So many young people that I work with are sneaking out and getting their iPads in the middle of the night, or they're keeping their phone on them and they're not going to bed until very, very late at night. And then here in Dubai, we get up so early for school that they're really just not getting enough sleep. And the blue light in our phones keeps us awake. It really kind of stops the production of melatonin and keeps us very wired, very awake. So if children are having access to these devices late at night, it's going to impact their sleep. And then we've also got the children who are sneaking out and going to get their devices even after they've been put away. So sleep is a huge problem with screen time, social media use. The internet use is a sedentary behavior. So we're seeing children being less active and more kind of on their phones, and that has health and mental health consequences. So we're seeing decreased activity physically, and an increase in health-related issues. And I think the most important one for me is we're seeing children engage less with one another. So if you look at the research of when the iPhone was introduced, and there's this really fantastic research that looked at when the iPhone was introduced and different measures of how children spent their time. And you see that the time that they spend outside with their friends has reduced, the time that they spend kind of dating others has reduced. So there's just less of that real interaction that we want our children to have, to really learn how to communicate, how to be friends, to give them a sense of who they are. It's really important that they have friends and they get out and they do things. And with that, we know that there are increased rates of depression, anxiety, and psychological distress with children who are using devices excessively. There's a lot more comparison, particularly with things like social media. There's this perception of people that is not real, and there's a temptation to put yourself out there in your unreal state too, which is reinforced, which then kind of makes you feel less than, because your real self is not the self that you present on social media. And all of that is happening at a time where children are trying to develop a sense of who they are, which is much more harmful than when we're using social media as adults, where we already have a foundation, we already know who we are before we go onto social media. So there's just a bigger impact on us. In addition to that, so there's, unfortunately, there's lots of cyberbullying that's happening, and it's quite hard to catch cyberbullying because people can just make fake accounts and kind of target you in other angles. It's very hard to kind of catch this. So that's a really difficult thing. More time online, feeling nervous and anxious. We're almost addicted to screens and phones and things like this. Neglecting responsibilities, sometimes oversharing or privacy problems. So I'm always educating young people about the photos that they put online and how they no longer belong to them. They now belong to Instagram or to TikTok, and that can go anywhere. And, right now as a 13-year-old, it doesn't seem to matter what you put out there, but imagine when you're 21 going for a job and you've got these pictures of you at 13 doing whatever silly things you do at 13. Sometimes it encourages antisocial behavior because there's this idea that I'm not seen, so I can say what I want, I can be mean to other people, or I control other people. Body image issues is a huge problem because people are always being presented this ideal body and this ideal beauty standard. And of course, harmful information and advice is sometimes out there online. So normalizing self-harm, for example. Unfortunately, there's a lot of pro-anorexia and pro-eating disorder accounts which are just popping up all the time that are hard to control, which is very damaging for young people who perhaps are seeking out that kind of information. So here's just some research from Ditch the Label that looked at where are children being cyberbullied, and you can see most of them are being cyberbullied on Instagram. I wonder if, this perhaps was done before the height of TikTok, but I'm sure TikTok is also a place where people are being cyberbullied too. And the impact of cyberbullying, so the issues that kids face, you can see most of the time it's social anxiety, and that's what I'm seeing a lot of at the moment, depression, We can see suicidal thoughts, engaging in self-harm, stopped using social media altogether, started skipping classes, developed an eating disorder, or began abusing alcohol and other drugs. So again, these are just some of the impact of being cyberbullied, what people then go on to do and how they cope. So let's think a little bit about warning signs that your child is struggling and then what you can do. So really, we're looking out for any significant changes to your child's behavior. So things like being, more withdrawn, more secretive, more quiet, or more obsessive. All of these things are perhaps things that we want to pay attention to and just kind of monitor and maybe have that conversation with our child. Definitely aggressive behaviors. And I think this is where it can be so hard, because your child who is aggressive is going to trigger you. You're human and you're going to have a reaction to their aggressive behavior. But this is one of the biggest signs for me that something is not right. If a child is hitting, shouting, breaking things, saying that they hate you or that they hate their parents, that to me is a sign of a child in distress who's not quite sure how to communicate that in another way. Any regressive behaviors, so kind of bedwetting, thumb sucking, basically going back a developmental stage, might be a sign of something that's wrong. Although I will say in the pandemic, some of that regression is very normal because all of this was going on. But I'd say now maybe it's less common. So children should have kind of come back up now that we're kind of in a state of less instability, although it is still very much unstable. Changes in sleep is a big giveaway. So if there's nightmares, or if they're not sleeping alone, or they're not going to sleep, that can be a big telltale sign. And of course, any changes in academic performance as well. So just kind of splitting it into the different kind of age groups. So again, if we think about our young children, so between 0 to 6 years, what we might see more of is excessive fear. We might see persistent nightmares, disobedience, difficulty separating from caregivers, trouble sleeping. It's not here, but you would also might see things like stomach aches or other kind of physical signs and complaints like headaches that may also present in the 0 to 6 years. From 12 to 11, you might see things like bedwetting, hyperactivity, loss of interest in friends and activities, temper tantrums is very common, a loss of appetite or a sudden change in weight, excessive worry about weight gain, sudden changes in sleep, and visible prolonged sadness. And in our teenagers, we might see excessive use of devices. There might be the victim or the perpetrator of bullying. There may be substance use and abuse, potentially seeing things that are not there or hearing things that are not there, destructive behavior, constantly threatening to run away, withdrawal from friends and family, and comments that suggest a desire to harm themselves and others. So just thinking about that split. So I'm going to quickly, because I'm aware of time, talk a little bit about depression and anxiety, and then we're going to talk about safeguarding mental health. So in terms of depression, what we're looking out for is a depressed mood or a numbness. Often with teenagers, it's a feeling very numb and irritable rather than a sadness, but it can also be a sadness that lasts at least 2 weeks and has a significant impact on their functioning. So you might see a child who's very tearful, you might see a child who's lacking energy, they might have difficulty concentrating, moving slowly. There's probably going to be changes in sleep and appetite and irritability. Now, the difference between sadness and depression is sadness is normal, and particularly if there's something that's triggered it, it's likely to last a couple of days, maybe even a week, but they can still take pleasure in the things that they typically enjoy. So they'll still want to do certain things, and there'll be minor changes to the way that they think, feel, and behave. Whereas depression, they're really struggling to take pleasure in things that once they enjoyed. It's more serious, it lasts for 2 weeks or more, and you may hear major changes in the way that they think, feel, and behave. You might hear things about feeling ashamed, feeling guilty, feeling hopeless. When it comes to anxiety, again, what we might see is anxiety is an umbrella of different disorders. So within that is eating disorders, post-traumatic stress disorder, OCD, and anxiety. So it's often felt very physically in the body. It can really impact functioning. It can often stop children from going out or going to school, depending on what it is that they're afraid of. And it really just feels very horrible to feel anxious all the time. And it can result in kind of physical symptoms as well. So stomach aches, as I said, or digestive problems, or feeling like their heart is beating very, very fast, having a headache. Those kind of physical symptoms might be more present with anxiety. There may be an irritability, an impatience, anger, confusion, kind of feeling on edge, or having kind of unrealistic or excessive thoughts and feelings about things. Behaviorally, often what we see in anxiety is avoidance. So people want to avoid the things that make them feel anxious. And obviously, in some cases, that's to be expected. If it's a lion, we're going to stay away from the lion. But if it's, school or something that's actually not threatening, then that's going to cause interruptions to their day-to-day life. The other thing we might see is excessive control, so obsessive or compulsive behavior, or wanting to kind of feel some level of control and finding it very hard to let go and to embrace, things that are happening in the world or in life. So again, anxiety is very common, very normal. We all have anxiety, and it's typically triggered by a specific event, but clinical anxiety may just come on sometimes completely at random. It's going to feel much more severe and long lasting, and it's going to cause excessive changes in thoughts, feelings, and behaviors, and impact that person more significantly. Okay. So let's think about how we can safeguard mental health, and then I will stop talking and give you an opportunity to ask me some questions. So, when we think about the basics, I think it's really important that the first thing I will always do with anyone, whether it's an adult, a child, or an adolescent, is to try and get their sleep better, because sleep has such a crucial impact on our mind and our bodies. So if they're not sleeping well, we can expect that their mood is going to be impacted, their anxiety is going to be worse. Everything feels worse with less sleep. So getting sleep right is going to be important, making sure they've got some exercise, some movement, they're drinking enough fluid, they're eating well. All of these things are very simple, but it's crucial to mental health. And then on top of that, we want to help children's emotional vocabulary. So we want to help them be able to express how they feel, and to help them to what we call name it to tame it. So we can see in the research and in the brains of young people and adults that when we put a word to the emotion that we're feeling, our amygdala, which is the part of the brain responsible for firing our fight or flight response, softens and reduces. So just having an understanding of what you're going through really reduces the emotional response that you're having. So helping your child as early as you can to talk about feelings is crucial. And it's often what I spend a lot of my time doing with adults and children, is helping them with their emotional vocabulary. And then we want to model to them appropriate emotional regulation. So in the family, we want to talk about our emotions and how we look after our emotions. We want to make sure that we create a platform for your child to speak, and that you're paying attention to your own emotional pain and triggers and looking after those things when we're looking after our children. Because if we're modeling to them how we look after ourselves, they're going to pick it up. They do as we do, not as we say, in that old phrase. So sometimes with children, I use an emotional hygiene wheel, something like this. Depending on the age, it might be the more simple bit in the middle, but if it's a teenager, I would use the full wheel, because the better we are at getting to the exact feeling that we're experiencing, the better able we are to then cope with that. So emotion wheels are a really important way you can communicate well with your children. We want to give permission to children to feel all of their feelings. And often this starts with us. We have to give ourselves permission to feel all of our feelings, because as I mentioned, I certainly grew up in a family where, you know, being angry and being sad and being jealous wasn't welcomed as much as being happy was. And so I had to learn to give myself permission to feel all the feelings. And a lot of us have had to learn to do that, or are still learning to do that. But letting them express anger healthily, letting them express jealousy healthily is going to be really important. Now, there are some behaviors that are not acceptable. So when you're jealous because I'm spending time with your brother, it's not okay to hit your brother, but it is okay to feel jealous that you're not spending time with me. Help them to focus on what is in their control. So this really comes down to children who are quite anxious, maybe about the pandemic, helping them to think about what they can do and what they can't control. And this is something, again, that we're always trying to do as adults. A simple thing, again, is limiting caffeine intake. If you've got a child who's very anxious, be very conscious about their coffee, Red Bull, energy drinks. I'm always telling teenagers to think about this because it can mimic the signs and symptoms of anxiety. We want to limit their technology. Children are not yet used to or able to control their impulses to be on their devices. So we need to step in when they're using their devices for a long period of time. And we need to set the limits for them until they're old enough to do that for themselves. We might want to practice mindfulness with them. This is a fantastic, simple strategy that takes no more than a couple of minutes every day that you can do with children. You can sit with them and do it with them. It's a really lovely way that you can help children feel more in control of their thoughts. Quality time, so making sure you have that kind of magic 15 minutes check-in with them daily. I know in a busy household, it's very hard to think, how am I going to give 15 minutes to all of my children? But if you can do that, and if they know that they've got that time with you every day, then it really helps a child to feel seen and to know that they've got that time. And it has to be quality. So it's quality over quantity. It's, when I'm with my child, am I fully present? Is my phone away? Am I really listening to them? I'm really focused on them. That is the most important thing. And if you want to learn more about this, I would highly recommend a book called The Power of Showing Up by Dan Siegel and I've forgotten the Tina Bison or something like that. It's a fantastic book, and it's all about, how important it is that we're present with our children at least some of the day. And maybe counselling if your child is struggling. Just a note on empathy, because this is something I spend all of my time really talking about. How do we really validate and empathize our child's feelings? So rather than saying things like, I feel bad for you, that's too bad, come on, it's not that big of a deal, or don't cry, or we need to be positive, or let's look on the bright side. If those statements, whilst they are very well intentioned, they're not empathizing, they're not validating the feelings that that child is having. So what you can say instead is, that sounds really hard, I can't imagine what that felt like for you, or tell me more about what that's been like for you, or how long have you been feeling this way? Have you ever felt these strong feelings before? What do you think might help today or now? And I know this can be especially hard when it triggers us. So, when we want our children to get along, it can be really hard to see them not getting along. And it can be hard to empathize with the child who's just hit their little brother. But if we can, take a few breaths to calm our emotional reaction, but if we can empathize with, I can see that maybe you are feeling really upset with your brother, or you're feeling really upset with me, then we're going to help them to manage those big feelings a lot better. Okay, so I'm going to stop there. How am I doing? I've got 10 minutes, so not too bad. I know there's a lot of content that I've just spoken about, and there's so much more I could say, but within this hour, we don't have a lot of time, unfortunately. But if you are interested in really kind of deepening your understanding of mental health in young people, I want to recommend 2 trainings. So one is for adults supporting adolescents. It's mental health first aid. It's internationally recognized. And we at the Lighthouse are the only accredited organisation in the UAE that can provide this training. So we have them running every other month, so you're welcome to join at any point. We also have online teen-to-teen mental health champions. So that's for teenagers. We have a younger age group from 13 to 15, and we also have 16 to 18. So if you want your children or your adolescents to get some training for themselves, because we know that most adolescents talk to one another, not to adults, then that is also a really valuable training that you can attend as well. So I'll just leave those there, and I'll just come to my Q&A just to see what questions we've got. Okay. So I've got a question here from somebody who said, how do you assess how much direct information you can share with the younger 7-year-old children about the ebbs and flows of the pandemic? I think that's a really good question. And maybe, you know, there's another presentation I developed at the beginning of the pandemic that specifically thought about COVID. So maybe, you know, we can run that session as well at some point. But I would say, you know, a little bit will depend on your 7-year-old and how, you know, what their developmental level is, because, you know, that will depend on each individual. But I think we want to be sharing honest information, but we also want to, you know, contain their anxiety. So for example, we might say something like, you know, there's lots of scientists and researchers and doctors developing all, you know, new vaccines all the time to try and help us, you know, tackle this COVID pandemic. So we're kind of giving them information, but we're keeping it quite positive. We're keeping it, you know, we're containing it somewhat for younger children. Older children, you can be a little bit more honest, but younger children, we really, our job as adults is to try and contain some of their anxiety, but we don't want to lie to them or be untruthful, but we want to give them the information in a contained way, if that makes sense. And the other thing I would say is ask them what they know, because 7-year-olds are very good at using technology, and they might be kind of online doing all kinds of things that we're just not aware of, and seeking their own information, or they're hearing things at school. So asking them, what do you know about the pandemic? Do you have any questions at the moment? Is there anything that's confusing you? And seeing if you can answer some of their questions is another thing I would recommend. Okay. Is there any data around the impact of devices or TV on sleep, particularly on timings or length of time on devices? Please share any links, as I need data points to convince my household. This is from somebody called Lucy. So off the top of my head, I don't know the exact data, but I know data exists. So perhaps I'll have to go back and have a look. There's a really good website. I'm forgetting the name of it now, which is not very helpful. I'll try and remember and send it in an email. But if you can DM Lighthearted Parenting, which is our Instagram, if you have Instagram, DM us there and I will get back to you on that. I've totally forgotten the name of the website, but it's got lots of useful information about screen time. But yes, so we can see that, you know, commonly they say an hour before sleep, 1 to 2 hours before sleep, you want to come off devices, because it has an impact on the melatonin. The blue light stops your melatonin production, which is the hormone that makes you feel sleepy. So if you're using a device 1 to 2 hours before you sleep, it's likely that it's having an impact on your sleep. In terms of, there's guidelines around how much time on devices children should have at particular ages. I know for very young children, it's very limited and it kind of moves up the older they are, but I can't remember the exact timings off the top of my head. But I will, if you DM the Lighthearted Parenting account, we'll make sure we get back to you with that question. My son is 6 years old, and every night he wakes up and comes to sleep next to us and says he is afraid or saw a nightmare. Is this something I have to be aware of, or it's just a phase? I would say Both. I would say it's probably a phase, because there's lots of young children, particularly at that age, who, you know, occasionally will get nightmares. I think if it's happening every night, that signals to me that maybe the fear is quite significant, because if it's every night that he's coming in, it's not necessarily something that's going away. It's kind of been quite consistent. I don't know how long it's been going on for. If it's a couple of weeks, that's not anything, you know, that I would especially kind of worry about. But if it's been going on for 6 months to a year, then maybe there's an underlying anxiety that we want to support him with, so that he feels able to sleep independently. So the first thing I would do is try and be very curious about what are his fears, what are the nightmares, what's happening, what might be worrying him at night time. And then you can together think a little bit about what might you be able to do to help him manage those fears. So in young children, it can be simple things like sometimes having a little picture of you beside the bed can offer a little bit of reassurance. Sometimes having like a dream catcher, if they're worried about nightmares, can be, you know, you can do that together. Or, you know, it will depend on the child, but those are some of the things that I do with young children when it comes to sleep. So I hope that helps. So if you have more than one child, would you recommend the quality time with the children be one-on-one, or can it be with all your children together? I think sometimes all together, but I think there's something very important about one-on-one time. And I know that's very hard when you've got lots of children, and it feels like maybe there isn't time for that. But having that one-on-one time with each child is really important. And as I said, even if it's just 15 minutes one-on-one time, and maybe it's not every day, maybe it's, you know, at the weekend you each get that one-on-one time, or maybe, you know, you take it in turns to take them out for a little date where it's just you and them. But one-to-one time is really important, because children, you know, often do feel threatened by their siblings to some level, and they're less able to be expressive and honest with you when their siblings are around. So having one-to-one time is what I would recommend. And my daughter is addicted to watching YouTube during every mealtime. Any tips, recommendations for me to change her behavior in a soft way? This is hard, isn't it? Because often I find that, you know, watching YouTube helps that child to sit at the table and eat their dinner. And then it becomes a bit then dependent. You know, you feel like if I take that away, she's not going to sit and eat her dinner, and she won't sit and eat her dinner. If she's got used to having YouTube there, then maybe, you know, you're going to see a regression in that behavior before you see an increase. But the problem with children watching YouTube whilst they're eating is we're teaching them not to be mindful about their food. They're not listening to their hunger cues. They're not really enjoying their food, because they're just mindlessly eating and watching something rather than sitting and eating, you know, and listening to their body. So from my perspective, whenever I worked with feeding and eating difficulties, as much as possible, I would try and avoid using this as a strategy. There might be cases where that child really won't eat anything unless they've got their YouTube. And in that case, I'd rather them eat something and have YouTube than anything else. But as much as possible, I would try not to have this as a strategy. So if it's already there, I'm warning you now, it's going to be hard to take it away, but it's possible. But what you're probably going to see is what we call an extinction burst. And what that means is you're going to see an escalation of behavior when you take it away, until that young person learns that, okay, we're not having the YouTube anymore. So you might start by limiting it. So you might say, you know, for the first 10 minutes you can have it, and then I'm taking it away. Or you can say, this is a new rule that we have in the family. No one's going to have devices at the dinner table. And maybe in the beginning, that, especially because she's only 4, she's probably going to sit at the table for 5 minutes and then kind of throw a bit of a tantrum. And then, you know, but over time, if she begins to learn that we're no longer having YouTube at the table, and maybe you can offer it as, you know, a little treat that she can have afterwards, for example. So you're moving it away from the dinner table. Gradually she will learn to respect that, and that this is the new rule. But I think it will be difficult in the beginning, unfortunately, but it's definitely possible. So as I said, maybe start gently, you know, limit it, reduce it, and then kind of eventually take it away rather than going cold turkey. Okay, unfortunately, I have somebody that I have to see now at 11, so I'm going to have to stop there. I can see I've missed a couple more questions, and there's some chats here. Really lovely. I can see lots of lovely messages, so thank you very much. Sorry I didn't get to all of your questions. I know I was a bit chatty today. Had lots to say, but it was lovely to be here, and I hope you all have a lovely week. And any questions that you have, please share them with LightHouse Arabia. So here we have Lighthearted Parenting or Smart Heart Board Game. If you send any of your additional questions here, someone will get back to you. All right, thank you very much. Take care and have a lovely day. Thanks, bye.